morning, everyone. Can you hear me? Just raise your hand if you can't. I speak in a very low voice, soft voice. Anyway, my name is Grace Dammann, and I'm so glad to be here. I'm grateful to you, Timo, and to the leadership at Zensen for inviting me to speak today. I was a resident here at one point for about 30 years. So I'm both a Buddhist practitioner and a physician. I practice with chronic pain and have done so for the last 13 years. And also I was in a head-on collision on the Golden Gate Bridge about 15 years ago. So much of my work has been dealing with the outcome of life-changing events, change body and mind. So what I'm going to talk about today is the intersection of medicine and chronic pain, because they have a lot to feed each other, or medicine would say in Buddhism. They are the two pillars that I always go to whenever I'm flummoxed or whenever I'm slightly overwhelmed by the categories or what I see as the facts of existence, which I've been in the last couple of weeks, as I'm sure many of you have been also. So, and because I'm 77, I no longer feel that despair is an option. It's not an option. And for full disclosure, I must add that I have tremendous faith in Buddhism, but less so in Western medicine for ameliorating or relieving suffering and healing. My go-to activities for when I feel overwhelmed are practice, connection, like today, learning, and sanctuary. And this place here has for years been my sanctuary. And even though I don't live here today, I still hold it in my mind. So sitting here right now, feeling wonderful. Thank you. As many of you, I'm sure, have heard, pain is a given in life, but suffering is optional. In the last 50 years, brain scientists, particularly in the last decade, brain scientists have made terrific advances in understanding how fitting or ahead of its time Buddhism actually is in talking about pain and suffering. After all, the Buddha said at one point, he gave the parable of the two arrows, meaning if you're shot by one arrow, that of course causes you pain, but only if you make up a story about that shot. You tell your mind, oh, I'm suffering. Does that then become suffering? And that's the second arrow, what we do to ourselves, what kind of stories we tell ourselves about the facts of existence. To look at the beauty and complexity of the pain pathway, let's think about boiling a pot of water that's boiling on the stove. I did this recently. So imagine you go to pick up that pot and you forget to put on a pot holder. What happens? Of course, your fingers and hands feel tremendous pain or noxious stimuli that's capable of damaging the body. Nociceptors are those receptors that we have everywhere in our body that can pick up stimuli capable of causing us great injury, even death sometimes. We've got them in our skin, joints, bones, muscles, where else? Viscera, viscera. And what they do, so what happens when the receptors are stimulated is they put out a chemical soup, and that chemical soup in turn creates an impulse, an electrical impulse, which if it's strong enough can activate and action potential. You all remember about action potentials somewhere in your past life, when you were in fourth grade, maybe. Anyway, that action potential in turn goes through the fibers, nerve fibers, and shoots up toward the spinal column to the brain, where the perception of pain is understood. This complex biosocial psychological phenomenon known as pain occurs mostly in the subcortical regions of our brain. While in typical situations, the stimuli or the noxious stimulation of pain may precede the actual event, and sometimes they don't overlap at all. For example, as a physician, I've seen many people in trauma who were horribly wounded, and they had no perception of pain despite their massive injury. On the other hand, you also can have pain without any evidence of tissue damage. The brain is the region where we shoot that second arrow. So in my case, I said to myself, what, you forgot to use a pot holder? You're demented. You must be becoming demented. You've got to go see a neurologist. You got to get neuropsych testing. That's the second arrow. And while we commonly experience pain phenomena as a single event, in fact, it's made up of multiple parts. There's both the sensation itself, what we call the noxious stimuli, and the nociceptors that pick it up. And then there's the labeling that we do to that sensation, when we call, and that's the labeling is what causes suffering. And also, it's increasingly clear that our attitudes toward that initial stimuli can also change the way we experience it. There's a wonderful story about Ronald Siegel, who was a psychologist practicing medicine at Harvard Medical School. He also happens to be a chronic back pain specialist. Anyway, he says that meditation can also alleviate our responses to that first sensation of pain. And he thinks that most back pain is caused by muscular tension rather than structural problems in the back. So sorry you're going. And many pain disorders are caused by this loop of increasing muscle tension when we get a noxious stimulus. And once we experience a pain sensation that we're afraid of due to injury, we bring all of our attention to it. And simply stated, that increases the pain no end. Siegel said, and he believes that not only suffering, but the amount of pain itself can be reduced by turning our attention to the pain, saying yes to the sensation. By doing so, the intensity of the sensation diminishes. Mindfulness, however, is not a panacea. Siegel was already a big Buddhist meditator when he was struck down by back pain. He said, I totally worked myself up so much. Despite the meditation practice, I was convinced that ever moving was going to cause me lasting injury in my back. So go to a doctor before you try to turn all your attention, because we want to rule out that there's no physical cause. Anyway, the key figure in understanding pain is, doesn't matter what his name was, but he has a gate control theory, which explains how pain can be gated. An open gate allows the pain impulses or the sensation impulse to travel to the brain. A closed gate doesn't allow them to travel to the brain. And in the brain, they're categorized and referred to as pain, as something aversive. Now we talk about the pain matrix as being different regions of the brain that contribute to pain. Nerve fibers carry impulses up the spine to the thalamus. From there, the thalamus, they branch in two ways. One goes to the somatosensory cortex, a region of the brain that contains a map of our body. And that tells us where pain is located. And then another pathway goes to the cingulate cortex. And this region tells us that the sensation is unpleasant. Amazingly, people have in the cingulate cortex experience pain, but they don't feel it as pain, meaning they experience the sensation, but they don't label it as painful. And pain lacks that urgent quality that gets us to pay attention to it. And it seems like there are subregions in the cingulate cortex that serve as a neural alarm to our bodies. They tell us when activated that physical pain or emotional distress, like the sting of rejection, they put us on alert. And they tell us to suffer. And once we start suffering, then we decide to flee. This area prepares us, in other words, for flight or fight. And when alarmed, we tense our muscles. And if we keep tensing our muscles too much, this leads to additional pain. The good news is that we can downregulate that. We can stop this secondary calling of there are parts of our brain like the prefrontal cortex, which tells us, no, this is not alarming. There's no reason to flee. You don't have to do it. Just stay. It's, in other words, what's going on is acceptable. And we relax our muscles, take a deep breath. Take a deep breath now, all of you. And we experience pain sensation without fear, without tension, and the sense of suffering falls off. This is the physiological basis or foundation of the parable of the two arrows. The impact of the second arrow is due to our resistance to the first arrow. When our resistance disappears, so it goes. And also there's a whole nerve descending network of nerves that tend to downregulate the initial sensation of pain. For example, light touch. How many of you, either, let's say when you're about to get a shot or when you've had sutures, how many of you have bit the inside of your lip? Anyway, that's another way to downregulate pain. We cause pain in another part of our body, and that reduces the initial pain. Pleasure also does that. How many of you have eaten chocolate? How many of you love chocolate? Chocolate does something in the thalamus, which also downregulates our sensation to pain and increases our sensitivity to reward. Same too with music and good friends. Those operate at the amygdala to increase our sense of reward. Now we get to chronic pain, which is the most common symptom that I ever hear about. Now, even when I was in private practice, it was the most common symptom. People came to me saying, "Doc, this hurts." And once I did away with the actual acute cause, then chronic pain is what persists for more than 3 months and or goes beyond the normal healing time that we would think, and or we don't have any other word or reason for it, then it becomes chronic pain. And the CDC estimate that 50 million people in the US suffer from chronic pain. About 10% of those, meaning about, doesn't matter how many million, 5 million. Anyway, I can still do that. Suffer from high impact pain, or pain that disrupts our lives on a daily basis, either by making our social, physical, mental, or work-related activity go down the chute. There's a higher prevalence of this chronic pain, of course, among older adults, among those living in poverty, among adults who were once employed but aren't employed now, among adults with disabilities, chronic diseases, medical diseases, and also there's an increase in chronic pain for separated, divorced, LGBTQ people, and of course, people living in poverty. That was the one I was looking for. Finally, chronic pain is said to involve 50% of those of us who are older. I'm not going to specify where older starts. And about 80% of nursing home residents. So up against this, actually, let me talk about a little bit about the opioid crisis. I'm sure you all know about the opioid crisis. You know somebody who's been involved in the opioid crisis, somebody who's attacked by it. Anyway, this is because in 1990s, we came up with this idea of a fifth vital sign. Vital signs are what indicate that you're alive to a doctor, meaning heart rate, respiration rate, blood pressure, pulse. And they added the fifth one of pain. And that, of course, increased the focus on pain and led to a huge increase in the prescribing of opiates, because they're the most effective medication for acute pain. So against that, we saw a huge number of increase in overdose deaths. Now, of course, prescribing patterns have changed somewhat, but we went from 20,000 OD deaths in 2000 to over 120,000 last year. Most of those are caused by synthetic opiates like fentanyl or diverted opiates like heroin. This, of course, led to a backlash in society at large. So opiates are no longer considered useful for anything but cancer-related chronic pain. And so all of my clients are having to find some other way, because once you start using opiates, I don't care who you are, how you are, you become quickly habituated, which means it takes more and more to get the same pain relief. And with habituation increasing usage, so overdose rates increase. So how is it that we can deal with pain? And is pain treatment possible? And if so, at what cost to the human being or to the nation at large? Now, at my hospital, which is a skilled nursing facility where everybody, of course, is in pain, we were charged to start a pain program. And most of the residents we dealt with have multiple chronic medical problems. Most of them are marginally housed, meaning they're likely to be homeless, drug abusing, or addicted, and psychologically challenged. We were very fortunate to be able to begin our program using ancillary treatment or alternative forms of treatment, like acupuncture, acupressure, all kinds of energy work, breathing, meditation, Reiki, music therapy, you name it, we did it. And because we're doctors, sometimes I walk down the hallway and I think I'm getting paid to crank my JBL speaker up as loud as I can and dance to the Aretha Franklin. I can't believe I'm so lucky. We used to have a large room where we could bring everybody together. We meditated together. We told stories together. We laughed a lot. We could listen to music. We sang together. Now we have to see each resident separately or individually. This won't be any surprise because of COVID. But we still crank the music up. We still open the patient's door because staff, everybody loves music. I mean, everybody loves music. Everybody loves to feel and groove on music. We start by creating relationships. We get to know our patients by asking basic questions like, how is the pain for you? How does it affect your life? How do you experience it? What does it feel like? Is it sharp? Is it dull? You can ask yourself these questions right now because all of you have experienced some kind of pain. So just ask yourself, how do I experience it? What does it mean to me? And all of our treatment modalities use either the bottom up, I mean, we start at the periphery, like touch and progressive muscle relaxation, all start at the periphery and send signals up to the brain, or we start at the brain by meditating, for example, or by imagery, go downward. We also, of course, are trying to get to know our patient by creating relationships to them, by touching them psychically, by touching them physically, by touching them spiritually. And most of all, we rely on those relationships for healing. We create, nurture, and support relationships. So ask yourself, what relationships do you support? What relationships support you? Beside the parable of the arrow, what does Buddhism have to say about suffering, about pain? Actually, it's got a lot to say about both things. It's essentially a training in compassion. Buddha said in his earliest lecture, my purpose in the world is single-fold. My purpose in the world is to relieve suffering. The Four Noble Truths, which the Buddha expounded, were about suffering, its cause, what creates it, what undoes it, and the Eightfold Path, which of course we all know. And at the end of this lecture, we're going to vow to save all sentient beings. Now, how does this help our pain, our human pain? How does vowing to save all sentient beings help us? I live at the Redwoods, which is a senior living facility. And I've got to say, the day after the debate, the tension and suffering was so thick, nobody could breathe. So I listened to a nearby table of grandmothers saying, let's talk to our grandchildren. We cannot let them fall into a pit of despair. And a woman in my meditation group that meets on Saturdays yesterday said, I feel like my job is to be a light to everybody here suffering, who's in pain. So we're not the first generation, nor will we be the last to live through catastrophe. And I'm going to talk right now about somebody probably not you've heard about. His name is Matsu. Just because I've wanted to find something talking about Buddhism during a time which the bottom dropped out of society. And the Ansan Rebellion is that time. John Herzog wrote a wonderful book about Chan Buddhism, which of course is the precursor to Zen in Japan and consequently here. And the golden age of Chan was during the Tang dynasty in 600 to 900 BC. And it was a period when art flourished, when culture flourished, when everything seemed to be going great guns. I'm sure the Dow Jones, they had it at that time, was breaking all records. But unfortunately, they had a long border to defend, and they had an imperial policy, all of which means constant warfare. And they had to hire mercenaries because they ran out of their own citizenry to be the armory. So it was a period started in 755, and it was a period of great famine, disease, warfare and death, poverty. And the population went from something like over 50 million to just over 15 million in 9 years. That's 2 out of every 3 Chinese died during that period. And some of our great ancestors, Bodhidharma, the 6th ancestor, Shitu, Lingji, Matsu, they were all born and lived during this time of rebellion. So I was really interested in seeing what they had to say. Little is known about Matsu, except that he was born at the western border of China near Tibet and began studying Chan when he was under 30, I think. Eventually, he moved into the center of China. And the attitude of Chan right at that point was kind of eclectic. I mean, it was off the cuff, not really interested in precepts, ceremonies, rituals, and it had kind of a dumbed down attitude, but it was rustic and freewheeling. Matsu left the border region, started studying with Wei Rong, who was his teacher. And there's a wonderful story about Matsu sitting in his hut, meditating, because he's still doing that. And all of a sudden, he heard a noise. And eventually, it was a grinding noise. He got so irritated, came outside and saw his teacher and said, "What are you doing?" And the teacher said, "I'm polishing a tile." And he said, "Why are you polishing a tile?" The teacher said, "I want a mirror." And Matsu said, "Don't you know you can't polish a tile and have it become a mirror?" And the teacher said, "Don't you know you can't sit in meditation and become a Buddha?" And Matsu said, "Oh." And he was really taken aback. And he said, "What should I do now?" And his teacher said, "Well, if the cart doesn't go, which do you hit, yaks or the cart?" Matsu started studying again in earnest with him. Now, Matsu is described as remarkable in appearance. I think this is part of the reason that I loved him. I loved him as Shuso, and I love him now. Anyway, he was like a bull, the gaze of a tiger. And it said that when he stuck his tongue out, his tongue would go over his nose and up to his forehead. And on his feet, he had 2 round circles. Another description is much more poetic, saying he was stalwart, standing like a mountain, and deep and clear, like still water. Doesn't that sound nice? So Matsu finally started walking during the Anshan Rebellion, and finally he ended up in Taiwan Monastery, where he had thousands of disciples. He had 139 transmitted disciples, which is like being a single parent, I think, to over 500 rambunctious children. And the teachings of him, because they were formed during this period of struggle, have an immediacy and a vibrancy to probably his best known teaching is contained in case 30 of the Mumang Khan, and it's called, doesn't matter what it's called, but anyway, one of his disciples, Dai Mei, came to him and said, "What is Buddha?" And Matsu answered, "This very mind is Buddha." And Mumon's comment, he's the commentator in the Blue Cliff Record, said, if you directly grasp Matsu's meaning, you wear Buddha's clothes, you eat Buddha's food, speak Buddha's words, do Buddha's deeds. That is, you are Buddha himself, I would say herself. Against the backdrop of China's most trying period, this call to the present was no casual invitation to stop holding on to the past, stop ruminating about the future. It is a spiritual battle. It's aimed at bringing the population that's in shock back into reality. The population had given up. They felt like there was nothing to be done. They couldn't make a difference. Does that sound familiar? Matsu's claim, everyday mind is Buddha, which effectively cuts off escapism either into selfish self-absorption or mystical abstraction, like God will pull me out of this. Ordinary mind is the way. We don't reject any lines of thought or feelings, flashes of anger. We feel generosity in the moment. I feel generosity to you guys. I hope you do to me. And that's happening in the moment. And we just can experience and be with this very moment, not with any other moment, not with the future, not with the past. We really do feel and care about closeness, no matter what the circumstances are. We right now are here. You've got the treasure in you. We all have the treasure in us. When Buddha stated, my whole purpose is to end suffering, the Four Noble Truths were his first Dharma talk. And in those truths, he said, yes to suffering, yes to its cause, yes to its cessation, yes to the Eightfold Path. And he didn't say with no pain. What Buddha did was to help create a path for all of us that can help us by practice avoid the second arrow. We spend a lot of time in the company of our feelings and thoughts. We practice together we meditate together, we hear a bird song together, not hearing it now, but at the crack of dawn, we do and hear. In other words, each of us lives a web of interconnected lives with both the invisible and the visible. And then, for no apparent reason, your neighbor coughs, somebody beside you moves, somebody drops something. The bird song or the coughing may put you in a place startlingly where you've never been before. That's what waking up is. Once there was a questioner of Matsu's named Shi Lao, who asked him, what is the meaning of Chan Buddhism? And Matsu kicked him, knocking him over. And Shilano just started laughing. And he said, later he said, I have not stopped laughing since Ma pushed me over. Your neighbor coughing can have the same impact, somebody pushing you over. But one of Ma's heirs said that his teacher taught him two crucial things. First, that each of us is already endowed with everything we need. You are endowed, I am endowed. Our enlightenment is already here. And second, that each of us is free to use that treasure, which is our endowment, to respond however we want to whatever it is that's around us. And Matsu was passionate about responding to the time as an essential part of realization. He was not interested in emptiness. He said, from the point of view of the Bodhisattva, which is what all of us are trying to do, be bearing oneself in emptiness and not knowing how to get out is like suffering the torments of hell. As our hearts and minds open in meditation, so too our hands want to open. And it's actually painful for us not to be able to use our hands. For Matsu, hell wasn't the trouble that he saw all around him. He was trying to escape that trouble. We started talking about pain in the fingers and my hand on the hot pot. That heat in hand started a whole signal that traveled up to my brain, which finally said, Grace, you're stupid. Grace, you need a neuropsych exam. Now, Matsu's prescription is much kinder. He said, take that mental debris. You need a neuropsych exam. You're getting demented. And just recognize that that's part of the mind. The mind itself is Buddha. This very mind is Buddha. We don't need to suffer. And like the physician, the adage that we were told when I graduated from medical school, physician, heal thyself. That healing is not isolated. It's not singular. It takes place within a web of interconnectedness with all of life's forms. It happens by meditating, most of all by practice, by forming intimate relationships, primarily with our own mind, and also with Sangha, which will point out where we don't get our own mind. Sangha is a great antidote to our own tendency to avoid. And out of this intimacy comes compassion, tenderness, that will in time allow us, I hope, to give the appropriate response to every situation we come into, whatever life presents itself. Thank you very much. Thanks. I'm open for questions. Yeah. You can look at fMRIs of people who are suffering from pain, and you can look at fMRIs to see what areas of the brain are lit up when people are meditating. You can find out that meditation does, in fact, strengthen some parts of the brain and reduces the impact of impulses in other parts of the brain. Does that answer your question? But I would say, yeah, TENS units are helpful. And I would say, keep track. Keep track. If you keep a journal of pain and you write it down specifically, this situation evoked this kind of pain in me. It was helped by blah. It went away by blah. It lasted by blah. How we remember pain is totally useless.
Distinguish suffering from pain in the brain.
Yeah, yeah. Parts of our brain have to decide whether or not that pain is alarming, threatening to the organism. Other parts can damp down the response to that pain. Yeah. Yes.
Please wait for the mic so that the people online can hear.
Thank you, by the way. That was an incredible talk. How do you go from the process of knowing that suffering is optional to believing in and embodying that suffering is optional?
That's a very great question. Tincture of time doesn't happen overnight, may not happen over a lifetime. I would say that that's the reason we all meditate, is to try to see what the contents of our minds are, try to learn what we do, what we have control over, which can change the nature of pain. Then we don't suffer. Like, I'm not suffering now, but believe you me, I was suffering right after I had my accident. Even though my van died, Timo had to push me in. I didn't have a working wheelchair. I mean, whether or not Timo was so afraid that he was going to have to give the lecture today. Luckily, he's sitting right beside me, keeping my papers intact. But I'm not suffering now. I would have, days past, I really would have been suffering, believe you me.
Thank you.
Hi, Grace. So I have something I have to do that's very difficult. I have a cousin who lost her son 2 months ago, and it was her only child, and she asked me to come and be with her. How do I approach a person who is both in pain and suffering? And those are undeniable responses to the loss of a child. And so I'm wondering, because I'll be leaving tomorrow, if you have ideas of how I can hold a space. I don't know the words, but I think you know what it is I'm going to be addressing, and how can I be a helpful person, which is how can all of us be helpful to those who are suffering.
You're smart. What would your answer be to your own question?
Well, so I've been asking this question to many people, and one answer I got was pay attention to your posture. And in paying attention to your posture, you will calm your mind. And that's what this person, my cousin, would most need, is to somebody walk in with a calm mind, rather than a mirror of her own desperation.
I would also just add that the most important thing you can do is just listen and truly be with the suffering, with the suffering. That's compassion, being with suffering and taking care of yourself in the process by breathing, by meditating, by interrupting it if you need to, by saying, I have got to take a minute, but just be with it. She has to go through grieving. You have to go through grieving. You have to go through her grieving.
I think my concern is that as a teacher, I will approach it as an opportunity to teach her how not to suffer.
No,
And wouldn't that be the word?
no, there is no way not to suffer.
Yeah.
You know better.
Thank you, Grace.
This is a question from Sarah. Thank you for your talk. You briefly mentioned that fear is involved in pain. How do we face this fear?
Didn't hear that.
You mentioned that here is involved in the pain. How maybe we face this here?
Oh, fear. I think once again, by knowing whether or not, finding out whether or not there's a good reason, whether there's a preserving reason for the pain, meaning find out if there's something wrong, find out if there's something you can change. And then once that's done, then you can deal with the fear and say, tell yourself, and you just have to live through it. Fear like grief, you have to live through. Tell yourself, this fear is off the mark. It's causing me more pain than not having it would cause me. Somebody back there.
Thank you for your talk. I'm wondering if you have any tips for helping someone who's dealing with, to support someone who's dealing with chronic pain over decades. And there's a difference between supporting someone who, say, broke their arm, or they're in the hospital, or it's a new and immediate pain. And you might handle that differently than someone who's just dealing with it constantly.
I think that's chronic pain dealing with it. That's exactly my population. They deal with chronic pain day in, day out. Anyway, try to find out what brings them joy. Touch them, touch them, touch them. If they'll let you, first ask, will you let me touch you? Can I hold your hand? Because touch can interrupt some pain fibers. Find out if they like food. You know, try to encourage the joyful side of them. Because my experience, for example, sitting sesshin on day 4 of a long sesshin, everybody here is in pain. Everybody's in terrible, terrible pain. And you just want to crawl out of your seat. And pain doesn't last for very long at all. So if that person can begin to realize the momentariness nature of even, there are moments in which pain disappears. Even for people with chronic pain, even with, think about it in childbirth, there's always that place when you take a breath and breathe. And I would say just be with it. Just be with it.
Thank you.
Thank you so much for your talk. Someone very close to me is suffering psychologically. Everything in her life is perfect, but she is really suffering psychologically, having to do with current political events. And I don't know how to help her. I mean, I try to be compassionate, but on the same time, I feel like her suffering is her own doing. And she should be able to fix it. And I don't know what to do to help her.
Well, I would say don't be with her if you feel like it's her fault. She can fix it. Yes, that is true. She can fix it, but not with your attitude of she should be able to fix it. So you're not wrong. You are totally right. And I would say work on yourself, work on when you've had pain, and realize that maybe you're not best suited. Maybe our heart doesn't really want to be with her in this process. Don't be with her until your heart really wants to be with her.
Understood. Thank you.
One at the back,
Very bad.
way back. Let's make this the last question. Okay.
Thank you so much, Grace, for your wisdom and sharing. I was wondering if you could talk a little bit about anxiety. How to be with anxiety as a chronic pain.
I'm sorry, I'm gonna have to ask Timo to repeat that question. I forgot to wear my hearing aids.
How to be with anxiety as a chronic pain.
I would say, keep breathing. Do you know that if you breathe 3 deep breaths, that activates the parasympathetic nervous system, which down regulates all of our flight mechanisms. Anyway, if you just take 3 deep breaths. And find out what else works for you.
Thank you.
Do have time for one more question.
This is from Mary Ann and Philip. How do you experience sorrow as you see your partner dealing with health challenges? Sorrow is different.
How do you experience sorrow?
So, as you are dealing with health difficulties,
Let it be, let them be. And also pay attention to what your sorrow is. You're also dealing with their health disabilities. And that's a big thing that we do as we age. We have to deal with our partner, also with ourselves. So I would say, just find out where you are, but take care of yourself, and then you can begin to open up to the other and be with them. Thank you all.